The most beautiful thing a person can possess is their smile, but it's also just as important to have a healthy smile. So this morning it's time to take stock of your smile. Joining us today is our smile expert, board certified Dr. Harley Richards from New Teeth Now. Good morning.
Hello.
Welcome back.
Thank you.
We've talked about this. It's so important. Talk about the importance of a smile.
Well, as we've discussed on previous shows, that's the first thing you see with a person. Just as you and I are interacting here, the first thing I see is your smile. And so there's the visual part as well as the bad breath part. And you know, if a person has a mouthful of bad teeth, or if they have ill-fitting dentures and they can't talk in public, or they can't eat in public. So from a functional standpoint, there's also some considerations there.
Yeah, and I love that we hear people's stories about how you are literally changing people's lives when they get this new smile, and we're going to hear in just a moment too how you can do that in about 24 hours. And right now we're going to hear Chris's story, and from what I believe too, on how his students reacted to this new smile that he had.
Yes, we will.
So let's take a look.
When my bottom crown broke off, I could no longer chew on this side. So I could only chew on this side. And then when the healthy but deteriorating teeth in the front started getting weak, I couldn't bite. That eliminates about 80% of what you eat. You know, when you're in business, you have to look somebody in the eye. And when you smile, you have to be sincere about it. But if you're covering up your smile, there is an unknown quantity going on that you're not as successful as you could be. I wanted to get back to a point where I'd have natural teeth. I came over for one of their day presentations. Everything they told me here just seemed way too good to be true. It was so much better than any other place I went in every respect. And to have it done in one day, all of it, that was very appealing. There's no pain when you do this. That's the amazing thing. You go in, you go to sleep, you wake up. If I had known how easy it was going to be, I'd have done it 6 months early. I really would have. So I'm 100% satisfied. And I'm really pleased with the folks here at Florida Dental. Apples, celery, raw carrots, corn on the cob. You don't even think about it. This is actually stronger than your normal teeth. I work with my youth, the kids, and this really happened. I'm sitting on a stool, and I got these kids are sitting around me on the floor, and this little girl, cute little girl, she's about 13, and I'm talking, and I did something where I opened my mouth, and she goes, "Oh my God, you have perfect teeth." Just like that. She was looking at my teeth. I go, "Well, thank you. I appreciate that." So that says it all.
Oh, I love that. And it's really truly remarkable to think you can have perfect teeth in 24 hours, essentially. How is it that you're able to do this so quickly?
Well, you know, I'm amazed a 13-year-old girl is noticing that. Well, a lot of doctors still do bone grafting, and one thing that we do is we use some special techniques, particularly these zygomatic implants that we use in the upper jaw. And at our center, we've been using these zygomatic implants since 2005.
Oh, wow, okay.
And presently, we do more of these implants in Lakeland at Florida Dental Implants than anybody else in the country. And they are extremely predictable, and we are very experienced at that technique, and that allows us to take care of folks who have no bone in the upper jaw without bone grafting.
And you can, you know, continuously hear stories of people how it's changing their lives. That must never get old.
Right. No, it doesn't get old. I saw a couple of people this morning, actually. Yeah.
Oh. Well, if someone's interested this morning, how do you find out if you're a good candidate for this, if this particular procedure, like you were just talking about, would work for them?
Well, if you talk to one of our highly trained consultants on the phone, they are able to educate you, and you will have a pretty good idea of whether you're a candidate. And
so you'll know right away just on the phone if this is something that's possible for you.
And then you schedule an appointment with one of the doctors, and we spend about an hour with our clients who come in, and we take a CAT scan, and all that's sort of a inclusive one-day type situation. And we're able to tell a person at that visit if they're a candidate, and whether we can do it all in one day, which is almost always the case.
So call today, as you said, again, for your new smile, your new life. Doctor, thank you so much. We always love when you're here.
Thank you.